Hi, I'm Sharon. I work as a consultant psychologist at Mysterious Minds. So, to start off, we'll talk a little bit about the most romanticized mental illness of our generation, which is depression. The mood disorder, Anna, like a lot of mood disorders, it does start teenage age. It can also manifest in adulthood. So, ഇതിൻ്റെ symptoms നമുക്ക് എങ്ങനെ മനസ്സിലാവണമെന്ന് വെച്ചാൽ mainly there'll be low mood, pervasive sadness. There will be complaints about, എനിക്ക് ലൈഫിൽ നിന്നൊന്നും കിട്ടുന്നില്ല, life is pointless, I don't feel worthy enough. So, a lot of self-degrading statements. That is one major cognitive aspect of how depression is manifested. അതല്ലാണ്ട് we can also see physical symptoms like lack of sleep maybe, കഴിക്കുന്ന ഫുഡ് കുറച്ചു, maybe you used to enjoy doing something a lot and now you don't do that. You don't want to go talk, you don't want to go play. So mainly children we see through their physical activities. They were involved in studies നേരത്തെ. ഇപ്പോൾ they may be sort of scaling back or they're falling a little bit in their grade. Again, feelings of worthlessness, decisions ഉണ്ടാക്കാൻ വരുമ്പോൾ അതിന് ബുദ്ധിമുട്ടാ. If you ask an opinion, they don't have an opinion at all. So when we see this as a consistent pattern for a period of time, then we can probably, with the help of few assessments, we can say depression ആണെന്ന്. But if you are feeling these symptoms for maybe a day or two, that does not qualify, or we cannot diagnose as saying that you have depression. And one major factor that we can look into is there are two types primarily. There is atypical depression and typical depression. ഇപ്പോൾ നേരത്തെ പറഞ്ഞ symptoms of low mood, appetite പോയി, weight gain ഉണ്ട്, pleasurable activities ഇല്ല, negative thinking. ഇതൊക്കെയാണ് typical depression symptoms നമ്മൾ പറയുന്നത്. And this is what we usually look out for when we try to diagnose. But there is also atypical depression. So ഇവിടെ വരുമ്പോൾ you might for a certain amount of time you might be happy. Responding to the environment, you will have pleasurable moments. പക്ഷെ അതൊഴിച്ച് ബാക്കി എല്ലാ സമയത്തും you will be a little sad. You will be thinking about negative thoughts, suicidal thoughts, low self-esteem, low self-worth, അങ്ങനത്തെ thoughts ആയിരിക്കും. But for a momentary period of time, you will feel happy. So that is how we try to see typical depression and atypical depression. And also in atypical depression, there is more sleeping, more eating compared to a typical depression. So ഇപ്പോൾ നമ്മൾ പറഞ്ഞ symptoms ഒക്കെ all of us will face this in a day or two. When certain stressors come, we might feel sad. Our self-esteem will go low. There will be some sort of suicidal ideation. അല്ലെങ്കിൽ few days we might not want to eat a lot. So none of these symptoms when we feel for a day or two, we can diagnose saying, okay, depression undenna. But rather minimum of 2 weeks, we need a pervasive low mood, suicidal ideations undown, ചിലപ്പോൾ low self-esteem thoughts ഉണ്ടായിരിക്കും. You cannot get yourself out to do things. Pleasurable activities will be low. So അങ്ങനെ once there are a certain set of symptoms for a period of time, first 2 weeks, apurana we diagnose it as depression, and depending on the number of symptoms, depending on the severity, we classify it to mild, moderate and severe. So because it is a very romanticized and a very in our generation mental illness, it is very common for us to use the language and say, okay, I'm depressed, I'm depressed. But we should inhibit ourselves from using that kind of term, but we can rather say, okay, sangada vandalini, I'm sad, I'm feeling a little gloomy. Because depression is a diagnosis, it is serious, and it is not equivalent to being just sad or just mood illa. Adalla depression. So that is something that we can definitely look into when we want to see if somebody has depression or not. Coming to how does depression develop? Who gets depression? Engane develop cheyyunnokkumbol there are a lot of factors, a lot of theories that has contributed to this. First thing we can look into is genetic factors. ഇപ്പോൾ ഫാമിലിയിൽ ആർക്കെങ്കിലും ഡിപ്രഷൻ ഉണ്ടോ ഓർ മൂഡ് ഡിസോർഡർ, ബൈപ്പോളർ ഡിസോർഡർ ഉണ്ടെന്ന് അറിയുവാണെങ്കിൽ ഇറ്റ്സ് ഓൾവേസ് there's a likelihood. There's no surety, but you are more susceptible to attaining a mood disorder. And ഒരാൾക്ക് ഫാമിലിയിൽ ഉണ്ടെന്ന് വിചാരിച്ച് ഉറപ്പായിട്ടും ഫ്യൂച്ചർ ജനറേഷൻ ഉണ്ടാവുന്നില്ല, പക്ഷേ there is a higher chance compared to somebody who has no family history. So genetics is always something we can factor in. ഇപ്പോൾ ഫാമിലിയിൽ ആർക്കെങ്കിലും ഉണ്ടെങ്കിൽ you can always get tested. If you are seeing symptoms, you can get tested to see if it's carried on or not. Another thing we can talk about how does depression develop is നമ്മുടെ surroundings. If somebody is already susceptible, if somebody has a family history of depression, their environment also plays a role. In the stressor, നമ്മുടെ environment, if any stressor comes, that increases the chance of us developing any mental illness, especially if there is a family history. So again, if you have a family history and you're always in a stressful environment, you're in a negative environment, a pessimistic environment, the chances are you might develop depression. So understanding how stress plays a role in combination with genetics is always something that we can look into. Another aspect of how depression can develop is parental, your environment, how you are brought up. If, there is a physical abuse, there is a physical assault always at the individual. It can be emotional as well, it can be sexual as well. അങ്ങനത്തെ ഒരു പാറ്റേണിൽ പോയിക്കൊണ്ടിരിക്കുമ്പോൾ automatically their thinking about themselves, the world and others will be more of on a negative stance. Their thinking about themselves can degrade, no self-esteem, less self-competence, all of that can factor in. Also how they see others, other people in the world. എപ്പോഴും ഒരു ഡിഫെൻസീവ് അറ്റാക്കിംഗ് ആയിട്ടാണ് എല്ലാവരെയും കാണണമെങ്കിൽ then that also adds on to the fact that you can develop depression. And lastly is about the world. The hopeless situation where you feel, nothing ever works out for me. I will always fail. There's no way out of this. So that kind of thinking pattern also sort of contributes to how depression can develop in an individual. ഇനിയിപ്പോൾ നമ്മൾ തിങ്കിങ് പാറ്റേണിനെ പറ്റി പറയുമ്പോൾ because depression has to do a lot with our cognitions, other factors as well, but also with our cognitions. We can see depression നിന്ന് പുറത്തിറങ്ങാൻ ബുദ്ധിമുട്ടാകുമ്പോൾ we'll see ഒരു black and white thinking. It's either this way or that way. There's no gray area in between. So even when we're facing problems, we need to be able to see there is a gray area. It is not only this way or that way. Another kind of thinking is personalization. എല്ലാം personally എടുക്കും. Anybody can say something normally, but then you thinking it's an attack on you and becoming defensive. All those kind of thinking patterns also slowly contribute to a depressive mindset. Another major thing why depression is seen as, a very, very severe illness is because of the suicidal thoughts and the behaviors that are carried on because of that. Suicidal thoughts can come up because of many reasons. It can be primarily due to assault, primarily due to abuse, and we accept it as truth. We have low self-esteem, we have low self-worth. So it makes sense why they would think it's better if I take my life, it's better if I don't exist. So anganta thoughts, once we start entertaining it knowingly or unknowingly, it will automatically put us in a low mood. It will put us in a low perception of ourselves and the world. So our day, again, thinking is coming, and when we don't deal with that, it can slowly move into depression. Now we saw depression and dana, we saw how it can develop. Finally, how do we go ahead with this? How do we treat this? Rather than self-diagnosis. If ഞാൻ symptoms പറഞ്ഞാലും, if you are able to see it in your life, rather than diagnosing yourself as having depression, get a clinician to diagnose it for you first. അവരങ്ങനെ പോയി കഴിയുമ്പോൾ we can see എവിടെയാണ് മൈൽഡ് ആണോ, മോഡറേറ്റ് ആണോ, സിവിയർ ആണോ, and depending on where we fall in that range, we can see which therapy to go to. Do we need medications in the first place? And there is also a lot of inhibition to taking medications, psychiatric illness medications എടുക്കുന്നത്. One thing that I would like to bring forward here is, even though we can, look into therapy and other ways where pharmacology is not used, where medications is not used, if it is in a severe form of depression, medication will only help or enhance to work on therapy. നമ്മൾ തെറപ്പിയിൽ ചെയ്യുന്ന ഓരോ കാര്യം ഇത്രയും കൂടെ എനർജി വെച്ച് ഇത്രയും കൂടെ മോട്ടിവേറ്റഡ് ആയിട്ട് ചെയ്യുന്നിട്ട് മെഡിക്കേഷൻസ് ഓൾവേസ് ഹെൽപ്പ്. പക്ഷേ ഇഫ് വി ആർ ഇൻ ദ മൈൽഡ് ഓർ ജസ്റ്റ് ഓൺ ദ ബോർഡർ ലൈൻ ഫോർ ഡയഗ്നോസിങ് ഡിപ്രഷൻ ആയിട്ട്, ദർ ആർ അതർ വേസ് ഇൻ വിച്ച് വി ക്യാൻ ഗോ. One of that is interpersonal therapy. In interpersonal therapy, what we try to do is we are trying to build a social circle around you. Someone to keep you in check, someone to help you move forward. Depressionlette oru karyam nammal nokkiya, the first or one of the primary symptoms we'll see is they start excluding themselves from any social situation. They don't want to talk to others. They don't want to interact with others. Vera aalkare parayana kekkanda. So we're trying to bring people back into an individual's life through interpersonal therapy. Another therapy is behavioral therapy. പേര് പറയുന്ന പോലെ we are working on the behavior. We're working on different aspects of depression. First was interpersonal, then is a behavior therapy. We can move ahead in terms of behavioral activation. പണ്ട് ചെയ്യാൻ ഇഷ്ടമുണ്ടായിരുന്ന കാര്യങ്ങൾ we're again trying to introduce those things into their life. Why this becomes important is putting yourself out there, doing activities will, release a lot of neurotransmitters, a lot of hormones that are sort of dying down because of depression. Serotonin, dopamine, norepinephrine, ഇതൊക്കെ നമ്മൾ ആക്ടിവിറ്റീസ് ചെയ്ത് തുടങ്ങുക, എസ്പെഷ്യലി വെൻ വി ആർ ഡൂയിങ് ഇറ്റ് ഔട്ട്സൈഡ് ദ ഹൗസ്, സം സോർട്ട് ഓഫ് ഫിസിക്കൽ ആക്ടിവിറ്റി, സം സോർട്ട് ഓഫ് ഫിസിക്കൽ എൻഗേജ്മെന്റ്, all these will slowly start coming up again. And the effect of these hormones are very beneficial. Them being released is very beneficial in combating a lot of things that come along with depression. Mainly, primary ആയിട്ട് what clinicians used for depression in terms of therapy is cognitive behavioral therapy. Here we are looking at the cognitive part, which is namada chinda, the thinking, how we interpret things, the behavioral part as well. That is how we act, how do we respond to a situation. In cognitive thinking or cognitive therapy itself, there are many aspects. We will look into cognitive restructuring, ഇൻ്റർപ്രിറ്റേഷൻ എങ്ങനെയാണ്, ആൾക്കാർ എങ്ങനെയാണ് ഓരോ സിറ്റുവേഷൻ ഇൻ്റർപ്രറ്റ് ചെയ്യണത്. സോ അതിലൊക്കെ ഫോക്കസ് ചെയ്ത് വി ട്രൈ ടു സ്ലോലി ചേഞ്ച് ദാറ്റ്. We try to slowly bring them into a positive mindset. So if there is a consistent way in which we think, we're trying to reframe now. So that is what mainly happens in cognitive behavioral therapy. And while focusing on the thinking aspect, we try to bring changes in the behavioral aspect as well. And lastly, like we talked about medications. Depression ulla ellarkum medication edukkanennilla. Again, depending on the severity, depending on what the clinician, the group decides, we can move ahead with medication. There is a natural aversion towards taking medication, adana side effects okay orthittu, but you can obviously ask your clinician, what are the side effects I'll be facing, side effects undavo. Because even if we are trying to stick to just psychological therapy, with the addition of medication, the response, the change will always be a lot better. Visible changes can be seen. It will help in improving mood. It will help in having that motivation to activate your behavior in every sense. So ഇപ്പോൾ നമുക്ക് മനസ്സിലായി എന്താ ഡിപ്രഷൻ, how do we notice or how do we look out for somebody who has depression, what causes it and how to go ahead with it. So ഈ symptoms ഒക്കെ കാണുവാണെങ്കിൽ, if you feel you might fall into this category, I would suggest that you would get help. You would go to a clinician rather than self-diagnosing, and then how to go forward with that. They will also help you with that. Thank you. This is Sharon Joseph signing off.